Namaskar, everyone. Odisha Society of America's Health and Wellness Group तरफ आपको समस्त में बहुत बहुत स्वागत. I welcome you everybody to the OSA Society of America's Health and Wellness Group. So we have a disclaimer here before we begin for this discussion to give the opportunity for everybody to participate in different questions and answers to get them feel safe and healthy. Before we begin, we have a disclaimer. This is not intended to replace your primary care physician. This service will offer consultation, advice, but not treatment of medication. We have detailed notes. Please take a moment to read through this. And if you have questions, you can always ask us. We are here to help you. I give like a couple of seconds for all of you to take a look into the disclaimer and read through this. Couple of meeting guidelines before we begin. Please keep yourself muted. This is a humble request so that we can have a better organizing the request and we can answer everybody appropriately. We encourage everybody to raise your hand. We have the option in the Zoom meeting and type the questions or unmute yourself to ask a question. We request to limit the answer duration to 30-40 seconds so that we can have a better coverage and answer maximum questions if possible. We encourage also everybody to switch on the webcam. So it helps the doctors to get engaged while answering. And please type your real name and city if possible, so that it gives us better understanding to answer your questions. Now, I would like to invite our Odisha Society of America's Health and Wellness Group President, Dr. Devas Roy, who is MD Associate Professor, Internal Medicines, Atlanta, Georgia. Please take over, sir. I think you are on mute, Devasish sir.
Pranam, namaskar again, and I welcome you all to this session of Ask Our Experts. And on behalf of Odisha Society of America and Odisha Society of America's Health and Wellness Group. As you know, Mahabharat or Ramayana, they happened over the ages, long time back. We read these stories, and the reason we read this story is we read the roles and the responsibility played by each actor. And after reading the story, we decide what role we should play. And this role has fallen on all the human beings when the situation arises. And this COVID crisis is more than a war, more than a nuclear war. And it has caused devastation that has never seen in history. So during this time, our Odisha Society of America and its Health and Wellness Group have risen to the occasion, and we decided we would present this direct interactive session with our community during this crisis to make sure that we let you know that we are there behind you all the time. Saying this, I'll directly go to Dr. Basan Mahapatra, who is the chief coordinator of this session. Basan Bhai, you can take it from here. Thank you again. Pranam.
Thank you, Devasish. And again, ସମସ୍ତଙ୍କୁ ମୁଁ ନମସ୍କାର ଆଉ ସମସ୍ତଙ୍କୁ ଯେଉଁମାନେ ଜଏନ୍ କରିଛନ୍ତି ଆମେ ବି ସ୍ଲୋଲି ମୁଁ ଦେଖୁଛି ବର୍ତ୍ତମାନ 29 ଅଲରେଡି ପାର୍ଟିସିପାଣ୍ଟ ହେଲେଣି ଇନ୍ ଆମ ଜୁମ୍ରେ ବୋଧେ ବହୁତ ଅଲଗା ଆସିଥିବେ ଆମେ ଫେସବୁକ୍ ଲାଇଭ୍ରେ ଆଉ ଥିବେ ଯାହା ହଉ it's a great opportunity for us all the members of OSA Health Wellness Group to to scale down some of the anxiety fears by this way. In the past, we have done few of this kind of seminars, and we faced a lot of questions, very common questions. I'm first wave. Bartman second wave aramala, and this is going so fast in India, particularly now in Odisha also. Is getting worse day by day. We are doing our OSA Health Wellness Group also while working very aggressively on the fundraising and also reaching out to some of the people in Odisha, poor people through some of our other NGO organizations. Let's start in USA. All these kind of seminars we'll do on a weekly basis. Every Saturday, we're planning to do for 1 hour, so that anybody has any common question, they can come, and we'll assemble a lot of specialist experts from different departments to do that. Bartman apan jo Devashish Koila well said that this kind of pandemic we never seen, like history 100 years back there was a pandemic, took millions of lives. That time our medical care was not that much improved even. But now with all the sophisticated ICU cares, all the sophisticated our drugs, even now a lot of vaccines, we still the Odisha, India, there is a big second wave and taking a lot of lives, and say data could be I don't want to discuss those because it's depressing. So what do we need to do? Sitting 1,000 miles away, we just can't be just sit and listen and watch. We have to do something. And I appeal everybody here, please join hands. Let's do something for our motherland. So while saying this, but I want to go over some of the topic. We'll do a lot of questions. This will purely Q&A session, and we have let me read out all the names we have in the panel. Dr. Sangeeta Pradhan, internal medicine. Dr. Sanjay Agarwal, he is pulmonary critical care. Sunita Kanumari, allergy immunologist. Dr. Devashish Rai himself, he's an internal medicine professor. Dr. Atosu Naik, he's a experienced cardiologist in Houston. Dr. Subhashish Mishra is an oncology surgeon. And Dr. Nivedita Mahanti, very familiar face, a family medicine in Virginia. And our guru, Dr. Nanakram Agarwal, he's a professor of surgery in New York. And Dr. Julie Samantrai, endocrinologist, Wayne State. And Bijay Thomas, family medicine, Lake Jackson, Texas. And also, we are really glad to have from UK, Dr. Subhash Pradhan, he's an adult psychiatrist. And then myself, I'm a practicing critical care intensivist and a cardiac thoracic anesthesiologist. And now before we go, we put together some of the questions, some commonly questions asked to most of us. And also we will take some questions directly from the. Let me start with some common questions we have been talking. A lot of people are asking us inside USA. Is it okay, Devashish, we can go to the questions directly now, or?
I'll just tell the next slide, then you can go. Very well said. Rashmi, next slide, please. Yes. So what we have done is all our members and Odisha Society of America and OSA Health and Wellness are pioneering this massive mega project, Help India Heal, for this COVID project in Odisha. And I'm glad to tell you that we have among us one of our esteemed senior member and a public figure, and who has been known for his humanitarian cause, Dr. Sitikan Das, who is the chairman of our fundraising committee, along with all the other members here. And I would request you to please pledge and do whatever you can using this link. We have this link in GoFundMe and other ways of sending your donations of place. And this is a time specific process, and we would request that we need to expedite this process and ramp up our thing and provide help to the people of Odisha in need. Thank you very much. Basant bhai, take it.
So thank you, Devashish. And we have seen last few days, I think yesterday or day before we started, we have seen a lot of funds coming to our campaign. A lot of people are donating, and I got a call from New York also this morning. Somebody is interested, is a doctor there. She's going to propagate throughout her hospital in New York and also in Florida. It's a good sign. So then let's go to our Q&A session. We have almost close to 40 people or 30 people. Well, so we have, is Bijay there?
Yes.
Yeah, Bijay. So I'll give you one question we discussed because I remember a husband and wife, they are positive. They become positive. They are having a 3-year-old child. How are they going to stay? How are they going to quarantine themselves in a 2 different rooms? Then who will take care of the child, 3-year-old?
Yeah. I think the child is in a much better state. Even if he gets sick, he won't be that ill. So, but the big thing is they have to protect the child by themselves, wearing masks when they're around the child. And of course, he's a 3-year-old. I'm not sure if he'll sleep in a separate room or sleep with them. So it's always good to have a separate crib, maybe in a different area for him, if possible. But I think as long as they're wearing masks and kind of, he should be fine. I wouldn't worry about it. I think anybody else can pitch in. Yeah.
Thank you, Vijay. Very, very good. And we'll go to Sangeeta, Dr. Sangeeta Pradhan. If you can take this question. One person say, I was positive 7 days ago. Now I found today my wife is positive. So since I'm positive 7 days ago, my virus, I'm getting better. And should I stay away from my wife quarantine because I'm afraid she may reinfect me after I get recover? And what should I do?
So the reinfection should not be that quick. They can still quarantine together, I believe.
Okay, very good. So, the next question, we have Dr. Who is here? Dr. Nita Mohanty, are you around? Probably. So, Dr. Atosu Naik, even he's a cardiologist, he's very involved in this COVID related things. Atosu, I'll give you the next question. I have a nanny who comes every day and is not vaccinated. And how do we reduce our risk of getting COVID?
Yeah, thank you, Vasan Bhai. It's a very good question. Actually, this is a problem in my house. My father is 86-year-old, mother is 84-year-old. They cannot cook. Now they need nanny, somebody to cook, somebody to clean the house and dishes and all these things. So what I advise them is, if nanny can be vaccinated, that is the most important. If she cannot be vaccinated, then she has to wear a mask. She has to wear a mask. And my parents, I told them when nanny comes, you have to also wear a mask. So both my parents were wearing masks, and also to see if you can maintain at least 6 feet distance when the nanny is working. Try to stay away from her, let her finish the work. Then after she leaves, then you can take out a mask and so that is the way my parents, and I think most of the household people are doing it. But best thing will be if you can convince or help nanny getting the vaccination. That will be the best thing to happen to the family. So till that time, till the nanny gets the vaccination, basically wearing the mask, maintaining, so basically practice the same CDC guideline, staying 6 feet away, washing your hand, and so that's the only thing we can do. Yes. And elderly parents, they have to have nanny, or they have to have people to help them in cooking food or washing dishes and cleaning house and all these things. So basically you have to maintain the CDC guidelines.
Thank you very much. Is Dr. Sadiq here?
Yes, sir.
Yes, good. Thank you. I have a question. It's a patient say, I have fever for 2 days. Cannot get COVID test. Should I go get a chest CT scan?
Typically, the infectious disease panel who recommend is getting a CT scan only if you have breathing issues. So I would not suggest that anyone should just unnecessarily go and get a CT scan until unless you have proven that you have COVID positive testing and having breathing problems.
Now that's very well said, because that's happening is a very common question in India now. People are trying to get, they are overflooding. You can get a CT scan outside, you pay money, and they are getting everybody getting CT scan. You have a little breathing problem. They don't check the even COVID test. They don't do pulse oximeter reading. Just they are straight going for CT scan. So that's but they're very well said, Dr. Sadiq. So so next question, I'll give to probably Dr. Sanjay Agarwal. Are you here? Dr. Agarwal? Okay, so I'll give it to Dr. Thomas, Vijay Thomas.
Yeah.
So
Yes.
should I take Fabiflu or ivermectin if I get COVID, if I get fever? Like his question is, I am okay. If I get something, should I start with that?
Yeah, I think the first thing is to make a diagnosis. And so now in India, the protocol is they're giving ivermectin and the Fabipir. And so I wouldn't say no if there's a physician in India who wants to start those medications early. So meaning if it's within the first 7 days, you definitely can start it if it's, if that's what the doctor there says. They do have some benefit, not a whole lot. And if it started late, actually doesn't help a whole lot because basically the viral load is much higher. So it doesn't really help a lot. But I think I would definitely ask him to follow what the doctor says. Those two medicines, even though they're not that strong, it still can be used if it's offered, but early on. And that's only after they test positive.
Okay, very good. And this is I'll ask, is Dr. Kanumori here, Sunita? Is she around? Oh, probably she's not here. She won't be here. Okay. And I would ask Dr. Sangeeta Pradhan to take this question. It's a pretty... Huh?
We have a live question. I would give it to you.
Yeah, let me give this one first. I have this morning somebody texted me this was really from New York. He said, I have Stephen Johnson syndrome. I'm afraid to getting COVID vaccine. Should I? Dr. Pradhan, can you take that?
So depends what the Stephen Johnson syndrome was from. I would definitely get a clearance from the allergist, but however, I think you should still go ahead and get the vaccine, but definitely talk to your specialist.
Perfect, very good. So let's go to some live question and we have some, then we can.
Yeah, is corona airborne?
Yeah, it is definitely airborne because I think the new CDC guidelines, actually not the CDC did the studies and they said from hands and all, the chance of getting coronavirus is 1 in 10,000. This is purely an airborne disease. And it actually can even go as far as like 10, 20 feet in the air. So that's why masking is so important.
So I think we have to be careful. I mean, what I'm saying this, there is so many confusions in all the things. Is CDC, CDC saying, a lot of people saying, is it airborne? Is it going in a droplets? So for the people to understand, I think also it has droplets go certain distance. Airborne can go indefinite, So we need a negative pressure room there. So that's why there is one study came from India, and that was significant. They follow CDC. Everybody look at it. People are wearing face shield with the surgical mask. 50% of them get less infected. Yes, if you have a highly infectious area, you should wear also with face shield or anything, so cover both. But thank you, Dr. Thomas. Devasis, we have one more question.
One more question. I would like Smita Ponda live to ask the question. She has written and I will answer. This is related to fundraising, so I will give the answer. Ms. Smita Ponda, can you be live on video?
Hey, Debu, mo camera is garbad.
Achha,
I'm very much here. Yeah.
Okay, so your question, I read your question. I'll read it. If you can say that's fine, otherwise I will read it out.
No, I can read it. Okay, not a problem. I'm sorry with all due respect, and I appreciate, and बहुत धन्यवाद प्रणाम आपण माने एमती करूचंती. But मोर गोटे क्वेश्चन हला आमे जो 361,000 रो गोल, and I also saw the blueprint, 10टा concentrator किनिबा 100टा cylinder किनिबा अमुक vaccine. So we have a plan for 361,000. My first and foremost question, because I have been part of many this fundraising and this disbursement. My question: will any of these fund will be going to, with all due respect, the remote areas like Ganjam, Kalahandi, Koraput, Fulbani, Balangir, or it will just save in Cuttack, Bhubaneswar, Puri? Okay. My second question is, our blueprint is for 361,000. What if our fundraise, God forbid, we only get $3,000? So do you have a thing, because we cannot wait. जो कहते हैं पागो भिडो भिडो कचेरी बरखास्त, we cannot wait. जदि आमे आज $9,000 करिचु, are we going to spend it right away, or we have to wait till 361,000, then buy all the 20 concentrator, and who is our supplier? Basically, I'm asking the execution side of it.
Exactly. Thank you, Smita. And wonderful question. Let me answer quickly before the experts chip in. So fundraising, Ray, we have see, to any project we do, people, whether it's outside ODIA or inside Odisha, we need networking. We need people who are accountable, and we need to know what we are doing. And for that reason, we have identified where we have the network at present, right? And that we have been very fairly selected Cuttack, Bhubaneswar, Titlagarh, Sunapada district, Balangir district, Berhampur. So these are 4 or 5 we have identified so far. Out of that, Bhubaneswar work has started, Titlagarh work has started, Sunapada work has started. So the other places, as we go along, we have the network, we are establishing the network, and when the fundraising is going on simultaneously, we are going to plan and immediately connect. For example, I'll give you, Sunapada was not in our, Titlagarh was in our focus. Sunapada was not there, but Japan ODIA Society, they came and reached out to me and they told the Bay, we want to sponsor the Sunapada district Seti Amaraju project. Right? So they are sponsoring that. And we are looking for also Oman ODIA Association. They reached out to me. The Bay, we want to be a part of that. So they are going to identify which one they are going to sponsor. So as we come, as the fund keeps on going, we'll identify a network and we will start doing. Unless we identify a network and people, responsible people who can work for us, we won't take the project. Just taking the money and throwing it, giving it to somebody and you lose track of it, we are not going to do that. We have to be accountable for each and every part that we collect and commit and make sure this is executed properly. That's, I think you got the answer for first one. The second one is, no, we are not waiting. Our network has started and we have foundation skeleton work has been laid. We have been working day, night. We're sleeping almost 4 hours a day for the last 2.5 weeks. So as the money comes, we keep rolling. And we have companies who are coming forward and volunteering to pay for us. Get this example I'll give you. We don't have concentrated, is not in our project. We have oxygen cylinders. There are no oxygen cylinders available for us to buy. Everything is hoarded in Black Bunny. So we identified an agent and vendor in China who has reserved 480 cylinders of 40 liters. So now that costs money and that has to be shipped to India. Somebody has to take the responsibility and then it has to be dispersed to our people who will be accountable. So this is a massive project. So for that, we have not raised the fund, but we have company which we have been discussing and they will take charge of receiving the fund and consignment, clearance, shipment, and they will even pay for us. So that process is on. So we are not waiting for anything and we'll keep on moving. And for a kind of information, it's not 3,000. We had collected around 12,000 the very first day. And the second day is yesterday. I haven't got the update. And we have multiple channels where we are requesting for pledge. Thank you.
Amount is 20,000.
Ketala?
Unaccounted yet, but 20,000, close to 20,000 now.
2 days, we have collected already 20,000. We started day before yesterday evening. So I think we will hit our target. I'm very positive and Jai Jagannath. Thank you.
Thank you, Devashish. That's pretty good. Very encouraging number. Thanks, Utkal, for helping out all this stuff. So, but we'll all, in every state level chapters I am hearing they are conducting this weekend, some fundraising campaign, and we'll make it successful. My next question will be to Dr. Julie Samantrai. this person say, I am on steroids for some other medical illness. Should I take vaccine?
So even if you are on steroids, you should still go ahead and take the vaccine, even though the antibody response may not be the best, but you should still go ahead and take the vaccine.
Very good. Thank you, Dr. Samudra. I fully agree with all. And next question will be is Dr. Subhasis Mishra. Please take this question. One patient is recommended by the doctors to have a surgery, colon surgery for cancer. And he's concerned, should I get it surgery now? Because he's scared to go to hospital, in all kind of stuff. So can you answer that?
Thank you, Basant bhai. So dita jinso eti bujhiya padiba amku gote hochi je gote loko elective surgery ପାଇଁ schedule ହେଇchi, but se bhabantu je if he or she gets exposed ki kaha kote full blown covid ହେଇchi, so then what should we do? This person is not covid infected but only exposed. तो सेही स्थिति रे हमको भलो हबो जदी आमे 2 weeks ପାଇଁ से सर्जरी को पोस्टपोन करिवा and we wait for symptoms. से लोकटा जदी symptoms develop न कला ताले ठीक अछि. So that is one scenario. Second scenario होची जदी से पेशेंट निजर कोविड हैला ताले हमें कोन करिवु, गाइडलाइंस कोन कहूची केबे सर्जरी करिवु, केना कोविड फिजियोलॉजिकली बहुत चेंजेस करे इंटरनली, तो सेट पे सर्जरी इज नॉट एडवाइजेबल, टिके अपेक्षा करियो कहउचंती गाइडलाइंस. बेस्ट हबो जदी पेशेंट को कोविड हेची किंतु तांकर सिम्पटम्स नाही, सो रेकमेंडेशन होची जे एटलीस्ट 4 सप्ताह अपेक्षा करिवे. जदी सिम्पटम्स होची कि रेस्पिरेटरी सिम्पटम्स होची ताले 6 सप्ताह अपेक्षा करिया पे कहआ जाउची. जदी को पेशेंट एडमिट होची हॉस्पिटल को किंबा तांको डायबिटीज अछि कि आउ कोन पे इम्यूनो कॉम्प्रोमाइज्ड अछंती ताले से दे शुड वेट 8 to 10 weeks. आ जदी के जने हॉस्पिटल एडमिट हेचंती बिकॉज़ ऑफ कोविड एंड तांको आईसीयू रे एडमिशन अबाउट पड़ची केना कोविड बहुत सिवियर अछि, सो मिनिमम 12 weeks. So gote a quick way of remembering this is 2, 4, 6, 8, 10, 12 weeks. Depending ki kemiti symptom ta rahuchi, amaro recommendation se ansare change habo, surgery ko ame kete din gunchai pariba. Jodi bhabantu elective surgery so ame adhika samay wait kar pariba. Cancer pai hele apana anya treatment kar paribe, breast cancer hele hormonal treatment kar paribe, colon cancer hele chemotherapy dei paribu. Those are much less intensive than undergoing general anesthesia and surgery. Thank you.
Very good. Thank you. Thank you very much.
Can I just add one more comment?
Sure.
Yes.
No.
Okay. It's very well said, Dr. Subhasis Mishra. You said the right thing. It's a common question that I have been also asked in the hospital and by patients. Now, if it's an elective surgery and you can postpone the surgery, the best thing that I tell the patients is get yourself vaccinated before the surgery. And if you can get an access to Johnson's 1-dose vaccine, it's better to get 1 dose than to wait for 2-dose Pfizer. But if you can wait for 6 weeks, then it's better to do that. The next thing that I have to tell you that most of the hospitals are taking adequate precautions. If it has to be done, they do test you for COVID, test 3 days before surgery. You have to be COVID negative before they do any elective surgery. And luckily, in the hospital, most of the employees are already vaccinated. I can tell you at Montefiore, the vaccination rate that I practice, it's over 94%. So if the hospitals are taking adequate precautions. So if you do need surgery, you don't have to be that afraid now that we are in the USA. But it's a different scenario back in India, where the COVID is rampant. In those cases, if you can avoid, do avoid and get vaccinated before surgery.
Thank you, Nanak Bhai. Nanak Bhai, yeah.
Can I add one more thing? I think Dr. Mishra is perfectly right on target, like basically with the timelines. And I think the one thing to remember is COVID is actually a pro-thrombotic state, which means that your chance of having clots are much, much higher in that like post, COVID phase up to almost 90 days. So we do see people getting heart attacks and strokes post-COVID. So basically, when you add a surgical insult, you're definitely going to see more complications. So exactly what Dr. Mishra said is perfectly right. You have to kind of time it at the right time. Yeah.
Very good. And now I was going to ask Nanak Bhai also. There is a question somebody sent. I was around someone who has COVID. I was around me, very closely around. And so after a week, he got the test himself, he's negative. Should I quarantine? How long should I do it?
Well, if he's already tested negative after he was quarantined, after he had been in contact, then I don't think there's a need to quarantine. But he should still take all the precautions as advocated by the CDC. So,
thank you, Nanak Bhai. And I have an interesting, actually, one midnight somebody called me. It's a true thing, and really, this question was to me, but I want to ask you guys to answer. It said my neighbor living upstairs. They live in 2 stairs. Living upstairs, whole family is COVID positive, and since last couple of days, I'm feeling like sore throat, heavy chest, like congestion, but no fever. What should I do now? Atasu, can you take this?
Atasu, unmute.
Okay. Thanks, Vasan Bhai. And it's a very good question. Actually, this is one of the practical problem, particularly in India, and where the space is kind of limited. If people are living in apartments and all this, so if somebody whole family is infected in the 2nd floor, and the person in the 1st floor has symptoms, I think he or she should think himself has COVID unless otherwise proved. In the sense, so we don't know, he might have come in contact with any of the family member upstairs, or maybe so it's better to think himself that he has COVID and he should quarantine. First thing he should do is of course, you can do the test later, but first he should quarantine himself. The second thing is monitor, as we routine things we do is somebody treat himself like a positive, check the saturation, check the temperature, and if there is any question, and then get a test done, either an antigen test or RT-PCR test later on, not now, the RT-PCR test. Of course, in India, the RT-PCR test takes about 3 days to come. Antigen test is quicker, so maybe can do the antigen test. But first thing is quarantine yourself and monitor the symptoms, whether you are having fever or what kind of symptoms, or you might have just a flu or something like that. But means it is better to be take care of yourself, thinking as a COVID rather than just ignoring the symptoms.
Thank you, Atasu. We have next. Yeah, go ahead. We have next one live question from Mrs. Swapnalata. Somebody is saying something?
Yeah, no. Basant bhai, wahan to kam kar sir. Out a live question, is interesting question. I'll give you.
Yeah, Mrs. Swapnalata Rath from Michigan. Mrs. Rath, can you go ahead live? Ask the question. Is she on? Hello. Yes.
Yes. Namaskar.
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 Actually, we were planning to go to a wedding, and we were vaccinated, so we were all excited. But this new variant from India, about the and I don't know about how it is in a general level how it is, but all these messages and everything, it's creating that concern. So what is the advice? I know we need to wear mask and everything, but the distance, maintaining the distance might be a problem. So is it still needed, the maintain the distance in the wedding, in the crowd?
Thank you, Mrs. Rath, and it's a very good question, and we are seeing a lot of people asking, so much anxiety. I'll ask Dr. Sadiq if you can answer this.
Definitely. If you are in a closed space, maintaining distance is a must. CDC has clearly said that you need to wear a mask and maintain distance of at least 6 feet if you are going in a crowded and a closed space, even if you are vaccinated. So there is no question asked that you should mingle in large crowds closely. But unfortunately, Aina to ame typically India upare concentrate karuchu. So I was Katha houtili jane infectious disease specialist who is also a member of the CDC. Say koile India re 6 feet distance would be too much, but masking and 3 feet is acceptable, even if you're vaccinated.
Yeah, actually, it is not, the wedding is not in India, actually, it is in USA.
Even if it is in the USA, madam, in the recent ruling about from the Supreme Court that religious places should be open, the mandate was even if you are vaccinated, you have to stand 6 feet apart in a religious place. So I'm sure a wedding also applies to the same manner.
Okay, thank you, Dr. Siddiq.
Very good. Thank you very much. And
mental health.
I'm going to get. We have Dr. Subhash Pradhan from UK. So we have actually there is a question. Let me see. That question was somebody. My neighbor. My neighbor. A couple of my neighbors are positive. I'm okay, but I'm feeling so much worried. I cannot sleep. I'm really scared. And COVID is everywhere. I'm afraid to go outside. What should I do? Dr. Pradhan?
First of all, thank you, OSA, as well as Apanagara Health and Wellness member Mangu. Thank you for giving me an opportunity. The specific question, there are some real risks. I do not, people have already talked about it. But so far as anxiety is concerned, what I'm telling is that these are all human emotions. There's nothing wrong in feeling anxious. The problem is that when anxiety is so overpowering that impairs your functioning, then only we have to take about, we'll be taking some specific precautions or steps. Should I start it now or I'll be
go ahead.
waiting for more questions?
No, go ahead. Do it.
So, okay. So in that case, should I have my slides? Like first slide, while answering that question, I'll also be coming to that.
It's all related. So it will be good to have those slides.
Yeah. So there are 4 or 5 slides. I should not take more than 5 minutes or so. Yeah. And then I understand we'll have another session. So, okay. So I have for the brevity of time, I'll be limiting myself to only a few slides. And thank you for once again for giving me this opportunity to learn as well as to share some of my experiences. I'm Subhash Pradhan. I've got around 30 years of experience in psychiatry, mostly in Australia, then in UAE, and currently I'm in the UK. So next slide, please. Could I have the next one?
What happened next slide?
I can go on, but I thought, probably.
The basis. Hello.
Rashmi, next.
Oh yeah, here it is. Okay. All right. So this is the one on a very personal note. I'll be very brief. We're all dreading those midnight phone calls, and one happened with me. That was on mid-December. It was my chota bhoni mate koutla nana mo bou uthu nahi kahinki kon karibi. It was a middle of the night. She didn't know about the time differences, and it was not COVID. And we finally found that my mom had died. And that was the thing. And I'm sure many of you must have come across these things in your personal life as well, directly or indirectly. So could I have the next one, please? So a quotation na bahut bhal lagla. So even if we might not be in the same boat, we're all different in our sort of placement, where we are, people in India where they are, but we're all in the same storm, or the ravages of a storm called COVID, and we're all facing directly or indirectly, we're all in the same sort of scenario. So what I'm going to say is probably applicable or relatable to many of you. Okay, could I have the next one, please? Okay. Gote kotha, we have to be very, very clear in our mind that COVID, as you know, is a reality, isn't it? It is no longer somebody is imagining that. So we have to be aware of that fact. So the COVID, the second wave we're talking about, the third wave, in fact, people have been talking about in the UK, NHS, and all those places, they're all, that is something that is going to stay. So as they call it, is almost like a new normal. So our behavior, many things have to change with time. So that is something we have to keep in mind. This is a prelude to what I'm going to say. But at the same time, as the gentleman was asking this question, to feel anxious is nothing wrong. In fact, in psychiatry, psychology, if you don't feel anxiety, if you don't grieve somebody's death, that is abnormal. That is something that is not expected. The problem is that, I mean, obviously we should make room for grief and for ventilation, but that's a common human feelings. In no way we're going to reduce or we're going to obstruct those things. That will be quite against our mental health. Next one, please. The issue is that when the anxiety and worry is so much, that is maybe in the term of its intensity or duration. Duration is usually more than 6 months. Somebody grieving occurred and one cannot function. And mostly when it impairs your functioning, that is the key word when we start to intervene. Like functioning means your personal, social, and occupational functioning I'm talking about. So those are the things you have to keep in the mind. Once that is there, we have to do certain things. One of the basics I thought of sort of giving a hint, maybe in the future or in the discussion we can come to it, is this our inability to tolerate uncertainty. As you know, probably the only thing constant is uncertainty, or as they call in a bit of a philosophical way, change is the only constant in the universe. So somehow we are tuned to believe that we will not be changing, we will be going in our way, and any sort of change, any deviation from the routine that pieces of apart, that gives us lots of anxiety. So that's the reason, that's the time where we should intervene, we should do certain things. So to make it easy, could I have the next slide, please? I have designed a setup. This is my talk I've given many places all over the country as well as elsewhere. To do that, probably you can't get a better mnemonic than COVID. As many of my medical colleagues would know, mnemonics make our job easier to remember. So if at all you take something out of my entire sort of 5-6 minute lecture, that should be it. All right, COVID. So C stands for cutting down and excessive reading on the COVID news, especially the anxiety-provoking news. You have to be very cautious. Experts, most people tell it should not be more than 30 minutes. So there are many things to watch, but if you focus only on that, unfortunately, any TV channel, even any news you open, especially from India, you'll be getting this sort of news, not news. So that's something you have to keep in the mind. So reduce your time or cut down the time. Second is when you are feeling anxious, one of the very common techniques psychologists or psychiatrists they use is called observing, based on the mindfulness techniques, where you have to sit and reflect upon what is happening, what basically you are experiencing inside and outside without reacting to it. Your job is just to experience what is happening. And they sometimes tell about what you are experiencing, what is happening outside, 3 things, 3 sounds you hear or 3 sights you see, things like that. So all purpose is to ground you so that your anxiety would be contained. So these are the time pressure techniques I'm talking about. Third one, visualization. You might have heard about it. Most of the CEOs do it. Most of those successful film stars, the sports athletes, they do it to very good effect. And visualization essentially is to imagine what you would like to happen in a positive way. All right. So that is something one can practice. With practice, you'll be getting better. And the fourth one, I stands for to inspire others. Especially I'm talking about inspiring our children, the people who look at us, not by what I was saying, but by our example. This gives us an opportunity to showcase what we are and how we behave in this sort of anxiety situations. D, the last one, but never the least, that's the essence of what we do. Some common distressing techniques. For the sake of clarity again, brevity, I have divided into 3 parts. The ARE, acceptance, relaxation, and exercises. Acceptance is a very important part. Very often we do not know that you are anxious, and we do not accept it. Some people go on alcohol binges, some people get angry, some people do certain things. But once you realize this could be anxiety, sort of manifesting in another way or masquerading in another way, that is one of the key features of de-stressing techniques. There are many varieties of relaxation exercises we have been talking about. So you can do anything that you like. Puja, meditation, if you like, that's fine. Or else you can take professional help as well, especially people who are more prone to have psychiatric problems. All right. Physical exercise, you must not, devaluate. It might not cost anything, but very often it has been shown that regular physical activities, at least for half an hour in a day or most days in a week, can give you immense benefits, not only for your body, but as well as for your mind. All right, so next one, please. There are only possibly 1 or 2 slides left. Could I have the next slide, please? Yeah, if any of you see this web serial, I really like it. The New Amsterdam is about a very charismatic doctor. I saw it because one of the Indian actors, Anupam Kher, was there. I was really mesmerized. His message was there, well, we have to start somewhere, and we must start now. And there is hope all the times. All right, so probably my last slide, but I have it before you go for question and answer sessions. I'm out of the time, so I'm just passing through it quickly. We can discuss a little bit more in the question and answer session. The next slide is basically a video I would like you to watch that sort of summarizes what I would have concluded, how I would have concluded. So please have a look. And at the end, we'll be open for question and answer. Please. The audio should be on.
Day is not coming.
Okay, you can follow marks. Right. So thank you everybody.
No, thank you, Dr.
Yeah,
Pradhan.
there are any questions? Thanks.
Very good. Anybody have any questions, Dr. Pradhan? They can come live.
Basant bhai, we got written question. How data
Can you read it?
just sort of, how will we identify with that we need mental health counseling in this stressful situation?
Okay, that's the one. Do you have another question you will tell right now, or after I
Another is
answer?
Waiting in line for vaccination. How to avoid crowd and unexpected fear of COVID while waiting.
Okay. Dita kamate related laguchi questions, but anyway, first of all, how do I know that I need sort of mental health assistance? I sort of, my third or fourth slide, I mentioned about that very clearly, that it is sometimes difficult to know whether it's a mental illness or it's a normal human experience. Our job is in no way, today morning I was discussing with Dr. Mahapatra about that, is no way to medicalize normal human emotions. Make it a point. Only when the emotions are so overpowering, that they control your life, that your functioning is impaired. The functioning in 3 spheres: personal, occupational, social. As a person, you are not able to function as a father, mother, whatever. In occupation, your job is impaired. As a student, you cannot study. All right? Social, suddenly your social activities are curtailed. Once that is there, it's probably time to get some help. Help is not always medicine. Help could be a session of counseling. It could be just observing the symptoms. All right? So those are the times you will be ready for, you think that, okay, I need some sort of mental health assistance. All right. Otherwise, most of the stuff you possibly can handle by reading, by informing yourself. That's the first question. Second, 1 second. So remind me the second question. Is it
second question? how to avoid the crowd and unexpected fear of COVID while waiting on the line for vaccinations?
Yeah, it's a difficult situation. What I'm thinking that suppose somebody is getting very panicky, anxious. So some techniques, as I mentioned in the COVID de-stressing technique, particularly deep breathing or visualizations are very, very effective in those techniques. To be effective, you must practice visualization before that. You must practice slow breathing before that. All right. So that is my advice, that when you are panicking, we know that everybody, we all are suffering, some person shouting, someone is dying. So you can see that is quite a very chaotic situation. So it is easily said than done. But the only way I would say that to practice some of those mindfulness techniques, called grounding techniques, as I discussed earlier. And that's what probably the only way, the situation that is been described. I hope I answered to an extent.
No, it's very good. Very good. Thank you very much. And we're
मोर गोटे क्वेश्चन अछि एठी बिकॉज़ माने बहुत गुडे केस जतबेले मो पाखु आसुची किबा बहुत जगह रे लोकन संगे कम्युनिकेट करची मु गोटे जिंस फील करची जो पेशेंट माने यूजुअली आईसीयू भीतर अछंती ओडिसा कथा मु कहूची भारत कथा कहूची जो माने आईसीयू भीतर अछंती जो पेशेंट आस्ते आस्ते टिके रिकवर करूची ता साइड बेड रे हला किबा पाखा पाखी बेड रे एते गुडे डेथ से देखुची एते माने पैनिक सिचुएशन से देखुची जैसे पेशेंट गुडा को तांको भीतर भी गोटे होप कमी जाउची तो सेही भले टाइम रे how to help them in terms of getting positivity जेतबेले so many negative things are happening around and खास करके गोटे आईसीयू भीतर
okay first of all, thank you Sabyasachi Babu, you are doing tremendous work. We all know that, and I'm really glad to be sharing these things. And yeah, coming to the question particularly, see, I probably don't have the right answer. I do not know. I mean, unless we know the specifics of the situations. And as I told before, when death occurs, it's common human reactions to react in a way. We do not want to take it away. That's what humanity is all about. That's what being human is all about. And there is no answers to that. But the point is that if you're getting so panicky that you do not take your own treatment, you do not do things that is right for you or for your near or dear ones, that's where we're talking about all these techniques I mentioned, particularly some techniques called grounding techniques, in the form of visualizing, and in the form of taking deep breaths, watching something outside, whether I'm really existing or not. Those things go a very long way, all right? And if it happens frequently in a person who is already vulnerable, for example, he has got a known history of mental illness, he has known a history of suicide attempts, okay? There you'll be requiring a personal, maybe a counselor, or so many sort of helplines are available. You can take help from them. I hope I made it to an extent clear, Sabyasachi.
I got a body question asked live. I will ask Dr. Siddharth Das to ask this question live if he's there. Dr. Siddharth Das.
Thank you, Hai. Thank you, Dr. Subhas, for excellent presentation. My question is, nowadays our kids are at home, online classes, and they are not going to play outside. There are no interactions. Only they are using their iPads. In that case, does that going to affect their that can cause psychological imbalance, and how to overcome it? How to manage by parents?
Yeah, that's a rather complex question. First of all, thank you, Siddharth, for coming with that question. I mean, that was a question for me as well. The same thing is happening in the UK here. Those similar situations. Two of my Albert twins. So both of them are now stuck to the computer, and so there is nothing else they can do, and we're really worried what's happening. Obviously, I mean, they cannot go out because of some practical reasons, because your life is more important than getting lessons. That I know. But there are ways. These techniques that I discussed can very well, in fact, be better applied in children than adults. Adults have some presuppositions. Many children do accept these things. This our Eastern technology of, say, our Eastern values, mindfulness, specifically I'm talking about, is very much acceptable. Many schools do teach about that, how to do it, how to handle that. That is for the children. But for the parents, yes, the anxiety is more for the parents. We know that. No, I must tell that. So far as, at least from the mental health as a psychiatrist, I must tell that very often we know that online teaching or online education, online counseling is probably as effective as the what do you call face-to-face one, provided it is done in the proper format, proper setup. Yes, I do admit that face-to-face has its own value, but so also online. Without this online meeting, for example, it would not have been possible for OSA, for me to talking from thousands of kilometers away to talk to each other. So I can see Manoj, one sitting there on Google. so guys from there, just imagine the importance of it. It has, in an extent, it's an, I must say, it is some sort of an opportunity for us to interact with each other in much more intimate way online than we ever could have done without it. I hope to an extent I answered your question.
Thank you, Subhash. So one, this morning I was going through some news from Odisha. It's why, Odisha Bhubaneswar AIMS getting 50 to 100 call per day from people because of they're so anxious, they're so scared. They say, we can't sleep. It's real. And they're like over flooded with these calls. So should they, we're focusing on the immediate treatment, oxygenation, all stuff, because we're not thinking about long term, those long haulers for COVID. I mean, we should have some program. We should have some. Would you advise even to our group? We should work on something for long haulers, like mentally illness.
Yeah, so thank you, Dr. Mahapatra. I mean, I remember discussing about that with you, but just for the information, there are lots of mental health helplines are there. I'm at least a member of so many. We Zoom call to so many things that we have been doing. Yes, it is available. The question is that whether people have got access to it or not. And many people do not know. They still suffer in silence, which they should not.
Yeah.
And yes, as you told, people should be, that underlies the importance of seminars like this, forums like this, so that we can discuss what we're discussing among us. We're all probably in a sort of elite class, but people, those who don't have access to it, how they'll be knowing? We should not assume that everybody has got access to Zoom, for example. So these are the things we have to think of. And talking about the long-term things, I can probably talk about for hours, because that's something my topic as well, from acute stress to how we become post-traumatic stress disorder, and what are the subsequent sequelae of this mental health issues. They say that there is a tsunami of mental health coming in following this COVID. Like we had the real tsunami, the super cyclone, for example. People still are suffering with that. But now, all those things that Mr. Sabyasachi is doing, they must be knowing. They are the persons that will be seeing it face to face, what people are doing. So they're just saying that no health is complete without mental health. Remember that. So that has to be there. WHO defines health as a state of complete physical, mental, and social well-being. Remember that. So once it is there, so we'll be able to deliver our care in an effective way. Thank you, and I'm happy to discuss about the future course sometimes.
No, definitely. Thank you. We'll be doing this almost every Saturday, and whenever you have free, please join us. I'm telling you, you'll have a lot of questions regarding this. So I have an interesting question. Maybe I'll request Sangeeta Pradhan to take it. Somebody wrote me, I am COVID positive, but not feeling any bad symptoms. I'm a little scared. When should I seek emergency medical help? Sangeeta?
Basan bhai, Sangeeta, I think had to go on an emergency. Can
you want to take? Who can?
Sanjay could do, no?
Sanjay, can you take this? Sanjay is there? Sanjay?
I can take this, Basan bhai.
Yeah, please do it. Atas.
Yeah, there are five. We call it the 5 signs of taking, asking for help or going to the hospital with patients. Number 1 is severe shortness of breath. If somebody has got fever, like a fever or something like that, or whatever, cough and all for a few days, and suddenly on 5th or 6th day, now it's having severe shortness of breath, persistent chest pain. That is number 3. If somebody is confused, like not able to concentrate, and of course, if he or she sees like bluish discoloration around the lips or inability to stay awake. These are the 5 important signs they should ask for immediate help. Maybe they need to be admitted in the hospital. Of course, if they have a pulse oximeter, the saturation has gone down below 90% or so, or running very high temperature. And, so those people should ask for the help, should call their doctors and get admitted in the hospital.
Thank you.
Thank you. There is one question. It's I got both vaccines, but never had COVID. I'm very protected. Should I keep a pulse oximeter and an oxygen cylinder in case I get the COVID from new double variants? Bijoy, can you take it?
Yeah, I guess, yeah, we can still get the vaccine and still get infected. The question is, how severe can it be? We don't know. Most likely with the vaccine, since one has had the vaccine, the intensity of the disease is much less, but we still have to take precautions. I wouldn't stock a cylinder, but I would still actually do all the vitamins and all. So I think definitely keep immune system strong. Keep a pulse ox, that's a good thing to do. And in case you do get sick or positive, just monitor your pulse ox over the next 10, 14 days. If you're 97 or higher, you've done really well. So based on how the pulse ox trends, if it's going down, start seeking help.
That's an interesting question. Thank you, Bijoy. Debasis, you have a pet dog, eh? Pet. You have dog. Somebody asked a dog question. He said, I want to get a pet dog. Should I be concerned if I take dog to the park or anybody makes her, or should I get infection from the dog, COVID infection? Anybody want to take Atasu, anybody?
I think Devasis should take it because he has a dog.
I would say there is no compromise in love. Everything is fair in love and war. So I will take it. Anyway, thank you. What a live question is, Sandeep Mahanti has, I think, two or three subsets of questions. Mr. Mahanti, you want to be live? And then Basant Bhai can distribute who want to answer. Thank you. Get in the camera.
Yeah, hi. This is Sandeep Mohanty. I just wanted to check out whether when an entire family is positive, and after the initial quarantine and the treatment period, if 2 or 3 persons become negative, then what would be the protocol in managing the rest persons who are still positive?
Who is Dr. Sadiq here? Can take this, sir.
Can you please repeat the question?
My question is, if an entire family is positive at a period of time, and over a period of time undergoing the quarantine protocol and treatment of medicines, some of the family members turn negative. Say out of 5, 2 turns negative and 3 are still positive. Okay. So then how do we manage the quarantine protocol out there?
The current guidelines have been stretched from 10 to 14. Some CDC members have recommended that after 10 days, you can safely go out if you're quarantining at home, because the severity is not that much. If you have tested negative, you can definitely step out, but you should follow the guidelines of staying within quarantine for the recommended period of 10 to 14 days.
That's what I'm saying. After that period, in case rest of the family members are still positive,
you can step out. If you have finished your quarantine,
I can step out, but they need to be inside isolation. So the persons who are still positive, they need to be in isolation inside the house. And the one who is negative can go out and carry on the activities for both the house and outside the house.
Yes. But again, within the house, you have to wear a mask because you still have the chances of transmission to the community.
Okay.
It's like me going into the hospital, or my friends who are all in this panel are going to a hospital. We all are bound to wear a mask and a protective covering because we have a chance of getting the virus from the patient and transmitting it to the community. So it is mandated that when we go and expose ourselves in front of people who are positive for the virus, that we are covered and protected. There was a statement in this discussion about air and droplet protection. That is the reason why we recommended full gowning and a mask for physicians and to examine patients. But unfortunately for the community, we recommend that at least 2 pairs of surgical masks is mandated when you are coming across anyone whom you think is probably sick.
But then the guy who has recently come negative, will he be able to catch it again?
No, he will not be able. So the person who has been recently infected it does have the ability to transmit the virus to the community. Same thing applies to the person.
My question is not that. I understand that question very, very, very loudly. But my question is, the guy who was recently was positive and then became negative, would he be able to again? Would the virus be able to again infect him immediately if he gets in contact with the family members who are still positive and inside the house?
No, sir. If the person has recovered from the coronavirus, the studies that we have, the limited studies we have, does not show of reinfection within the period of 3 months.
Okay. That was my question. Thank you so much. Thank you
No
so much.
That was thank you very much, Dr. Sadiq and Mahanti. And we have a question on the Facebook by Bhagyasri Singh from UK. And the question is, what is the current guidelines for Covishield and Covaxin in pregnant and breastfeeding women? And please, anybody can take it.
I'll take that because we recently were told that pregnant women and breastfeeding women should go ahead and take the vaccine.
I mean, they're talking about Covishield and Covaxin.
Yeah. And since Anthony Fauci just recommended recently that Covaxin and Covishield are equally efficacious vaccines, I think it is applicable to, I'm not very sure about Covaxin and Covishield, but as far as Pfizer, Moderna, and Johnson is concerned, but Fauci said they are equally efficacious and the same, what was the terminology used? Modulator mechanism for the Covaxin and Covishield. So I would say that I think it's very safe, and you should go ahead and take the vaccine, come what may. Please do.
Yeah, thank you very much. There is one more question by Manoj Patra. Some people show more reactions: fever, nausea, diarrhea, special what is this? Especially after the vaccinations.
Yeah, I can ask it live. So,
please do it.
What I have observed is that, especially after the second dose, some people seem to be expressing more reactive signs. They tend to fall sick, have fever, even for prolonged period, like 3, 4, 5 days, up to a week also. And some others don't have anything apart from a minor ache in the place where the injection has been given. So, is there any difference in the effectiveness in these categories for people? Is the vaccine going to be more effective in category A versus B, who feel this, who show this reaction or not?
Atasu, you want to take?
Yeah. See, you are in US, so I can tell you about Moderna and J&J and Pfizer. See, the side effects from the vaccines are more what we have seen with Moderna. The incidence is about myalgia and all these things, maybe 80 to 90% or so. But it is less in Pfizer. And actually, the least side effects we have seen with J&J. The incidence is about myalgia, body ache, fever, all these things, about 30 to 40%. Now, question is, people ask me, when the vaccination came, people used to ask me which one I should take. Should I take Moderna? Should I take Pfizer? Of course, J&J came later. So what we do is the mRNA, the dose of mRNA is about 100 micrograms in Moderna and about 30 micrograms with Pfizer. I don't know, maybe because of the amount of mRNA is maybe the mRNA is more with the Moderna, maybe the side effects are a little less. It's a little more in Moderna compared to Pfizer. But the least side effects we have seen with J&J. And as you said, some people get and after the second dose, they become very sick. Some people may not feel anything. That depends on the immunity of the body. That does not mean that the vaccine is effective. If you have got more side effects, the vaccine is really effective. If you don't have side effects, it's not like that. And the effectiveness, all of you know, is about 94.1%, whatever they say for Moderna, about 95%. For the Pfizer, and of course J&J, severe, it protects 85% protection against the severe infection. But only in the trial, what we found, one good thing in the J&J, after 100 days of J&J vaccination, the chance that somebody will get severe infection or hospitalized or die from COVID is almost zero. So it is also same with the Moderna and Pfizer. But one thing just I wanted to mention, I think people once they get the vaccine, they think that they have a certificate. They can do anything. They can travel anywhere. They can go and. But actually, that is, I think that's a kind of a misnomer in the sense. Yesterday, what we found out, the latest statistic is we have about 110 million people in US have been vaccinated. 9,245 people have breakthrough infection. And out of that, 830 people have been hospitalized and 132 people have died. This is the data in the US. So somebody, because have got the vaccination 2 doses, that is not a passport. You still have to maintain the CDC guideline.
Okay, thank you, Atasu. We have another call. I think this will be our last question. We are running out of time already. This is my friend Brajendra Nath Ponda. Please go ahead, ask the question live.
Okay. First of all, thank you, Vasubhai and others for organizing this. This is a great service to the community. So my question is, when this COVID started, people are so scared and that people can touch things and get infected. So we started, everybody started washing vegetables, wiping out wiping of the cereal boxes, all these things we get from outside with these disinfectants. Should we continue to do that? Because now they are saying that it does not transmit via touch and all these things.
Vijay, you want to take? Anybody wants to take this?
Yeah, I think the CDC has definitely kind of came out very strongly saying that this is more airborne, and through touch, the chance of getting it is 1 in 10,000. So it's much less. So, but I think it's still good to practice, good hygiene. It's always a good thing, like hand washing and this and that, because it's not just for COVID, it's for other things too. So I think, we don't have to be aggressively washing our vegetables or other things, but definitely practice hand washing. And the most important thing is you definitely keep your mask on. Yeah.
Thank you. So we had a very good discussion. We're looking for our next weekend. Also do that. We'll send you all the Zoom link. Before you go, I'll just give you a few words. All the discussion we have. I did have few questions, but we don't have time. We'll take next time. But let me tell you this virus, like you say, a lot of questions about this strain, double strain, all this stuff. But usually the virus, as we know, in laboratory they find this coronavirus mutates every 2 weeks, like every 15 days mutates. So what happening now? Mutation can only happen, if replicates, and replication only happen if infects somebody. If it goes from me to you, somebody, this way it happened. So if you stop the chain of transmission, this virus will never infect somebody. It doesn't infect, they will not replicate, then it doesn't do any new mutation. So the nature of any virus, they will mutate, no matter what, they will go. When they replicate, mutate. So the key is you take vaccine, we should all take the vaccine, but remember, like Atos was saying, 95, 90 or 80, 70%, whatever effectiveness. Let me tell you, no vaccine, no coronavirus vaccine is give you 100% protection. Only it protects you only from severe illness and death probably. But with the new findings also, we are scary. So what is the best thing to do in addition to even which is most efficacious is a masking. And we should all use mask when you go public places. There is chance of infection, or if you have surrounding somebody, and you should be properly wearing mask. You cannot have mask under the nose or on the covering the chin. It has to be protected so nothing can get in. So if you say airborne, it has to be really masking is very important in addition to your social distancing that always stay. So thank you all again. And Devasis, if you say some few words, you can wrap it up.
Thank you, Vasant Bhai. First of all, I want to thank all the members and all the participants who were here and asked questions, and that is why we are here for. And we will be there with you all every Saturday. We want to have an open access so that all our community people can come and directly interact with our experts in here and make sure that we answer you and we are behind you. And then I would like to thank all the experts here who devoted their time out of their busy schedule to be with you all. So my thanks to all of them. And then I would like to thank our Odisha Society of America for being the champion behind us and giving us the platform also to reach out to the communities. Saying this, I would like to see you all again next Saturday, same time, same connection. And let's keep the ball rolling, and so that any anxiety, any stress, any questions you have, we will definitely be there to answer and help you all. Thank you, and Jai Jagdish.
Nanak Bhai, you had a question?
Yeah, no, I just wanted to make a comment if allowed. I have to sincerely thank Sabyasachi Mishra, Devashish Rai, our leaders from OSA, and all the OSA Health Wellness. You know, this is a war that we are fighting. And if you have to take one message from the Gita, and this is my plea to all my brothers and sisters, don't sit back, stand up and act. Let's put the message around and let's collect every dollar counts. You know, there's a famous saying from President Kennedy, don't ask what the country can do for you. So let's not ask what government of Orissa or government of India can do. Let's ask what we can do. And the minimum we can do from this country is send aid to Odisha. So please, let's all join this fundraising. And I tell you, they are all working very hard. I've never seen that somebody is working so hard, not even sleeping 4 hours a day. You know, so I don't want to go more into what they're all doing. I can tell you this will be all success if we all act. So please spread the word around and let's collect the funds that we need. Thank you all.
Thank you.
Thank you, bhai. Thank you very much. Before you end up, mu khali gote jinsa kaya pai chahuchi. Ask your doctor Vitre, I want to thank our doctors. Kana mane believe me, I feel so emotional. Kana जदि आमे एबे भी गोटे होप भितर अच्छे जे आमे भलो हबु आमे ठीक हबु पुनी आउथरे नॉर्मल लाइफ को लीड करिवु ताले तारो मेजर चंक तारो से होप रो जाउची डॉक्टर मानकु द वे दे आर फाइटिंग ग्राउंड जीरो रे थाई कि इवन अन्य बाहर जगह रे थाई कि सेटा माने वर्ड्स ताकू डिस्क्राइब करि परिबनी आ विशेष करी मु यूएस रे थिबा जो ओडिया कम्युनिटी हमर ओडिशा सोसाइटी ऑफ अमेरिका रा प्रत्येक माने मेंबर जो माने एते इमोशनली कनेक्ट होचंदी ओडिशा सहित आ एटा आजिरो कनेक्शन नुहे आई हैव नोटिस्ड फ्रॉम द वेरी फर्स्ट डे जेबेठु आमे एसोसिएट हिचु माने मोर मने पड़छु फर्स्ट प्रोग्राम रु आपण मानकर जो फीलिंग्स अच्छी ओडिशा पे सेटा जे ट्रू सेटा जे ऑनेस्ट आ ताको मु सब बेले सैल्यूट करे सेत पे मते बहुत प्राउड फील हुए जेते बेले मु कोनोसी प्रकार रे एसोसिएट होबा पई चांस पाए ओसा एग्जीक्यूटिव मान को बहुत बहुत थैंक्स देबी कुकुपा अनिल भाई उत्कल भाई दे आर माने एक्सेप्शनल तांकर स्पिरिट तांकर जो प्रकार जोश सेटा बहुत रेयर आ ता सहित सब मेंबर्स मान को बोर्ड ऑफ गवर्नर्स को जो माने माने अल्प दिन भितर गोटे गोटे दिटा मीटिंग हला एंड एवरीथिंग इज लाइक आमे करिबा वी विल हेल्प ओडिशा तो सेही भलिया स्पिरिट बोधे बहुत रेयर आ हेल्थ एंड वेलनेस ग्रुप रे प्रत्येक डॉक्टर्स माने जो माने तांकर पर्सनल लाइफ रे तांकर निज पेशेंट्स तांकर निज प्रॉब्लम सब के ताको भूली किरी जो वसुदेव कुटुंबकम जोटा जोटा फैक्ट जोटा को से माने प्रत्येक मोमेंट रे से माने पहुंचुचंती तो आपण डेडिकेशन ओडिशा केबे भी भूलिबनी आ आपण मानकर जो ए जो स्पिरिट एटा ओडिशा को कोविड को हरेबारे बहुत सहायता करिवो आ गोटे कथा मु आज माने माने बेटर से तो कहि परिबी जे आज हमें जो दुख करछे जो कष्ट करछे जो प्रकार एफर्ट दूचे 2 वर्ष 3 वर्ष 4 वर्ष की मे बी वर्षे परे वी ऑल विल सेलिब्रेट कि वी हैव सेव्ड थाउजेंड्स ऑफ लाइव्स तो सेटा हमर रीजन हबो सेलिब्रेशन रो तो वी आर माने ऑन द राइट ट्रैक विथ द राइट मेंटालिटी एंड राइट स्पिरिट सो लेट्स डू इट
Thank you Sabya.
देवाशीष भाई निहार हियर वो गोटे भाई मेसेज देबा को चाहू कि माने मु तो आई एम रियली इन ए जूनियर पोजीशन बट मु whatever I'm hearing from my friends, the situation is really bad everywhere. Everyone knows that. समस्त में जानी छु किंतु also one thing to keep in mind ki doctor mane bhi moniso semanakor bhi family achi. So jodi amar kiछि mane patient manakor kiछि problem hochi semane bhi dukhi hochuni, but resources are limited. So jodi kiछि problem hochi, don't assault the doctor, don't keep anguish against the doctors. Samaste try କରୁଛନ୍ତି କାହାର କେହି intentionally କାହାକୁ ହଇରାଣ କରିବାକୁ ଚାହୁନାହାନ୍ତି. So ସବ୍ୟସାଚୀ ଭାଇଙ୍କୁ ଗୋଟେ ଅନୁରୋଧ ରହିବ, ଯଦି ଜିନିଷଟାକୁ publicly ଟିକେ ସବୁ ଟିକେ awareness କରେଇବେ କି ସମସ୍ତେ relentlessly work କରୁଛନ୍ତି, ଆଉ ଟିକେ ଯଦି support system ଯଦି public support ରୁ ମିଳିବ ବି ବହୁତ ମାନେ ଖୁସି ଲାଗିବ. And another thing hochi ମତେ ସେ ସାଙ୍ଗ ମାନେ ମୋର ସବୁ aims and SCB ରୁ ସେମାନେ ସବୁ contact କରୁଛନ୍ତି. Situation is really horrible, everybody knows that. So ଏଇ ଯଦି public message ଟିକେ pass କରିବେ ଦେଲେ ସମସ୍ତଙ୍କୁ ଟିକେ ମାନେ betterment ହବ କାମ କରିବା ପାଇଁ.
The very good input. ମୁଁ ମାନେ କାଲି ହିଁ ୟା ଉପରେ ଗୋଟେ ଭିडिଓ କରିବି and definitely I will reach the masses.
So what we can do is, Nihar, very good input. Next session day, we will put a slide about how to interact with physicians, your healthcare providers, and frontline workers. Definitely, we'll keep it. Basant bhai, we'll keep that in the agenda there for the next session. We'll prepare that. And Sabya, you can spread that also. Plus a session dialogue, that also you can share.
Yeah.
That also, yes.
Absolutely agree.
That is a real problem.
That's a very good idea. Yeah, we'll do that.
Right. Okay.
So thank you everybody. Nahi, it is very good. Everybody.
Thank you so much.
Thank you, sir. Thank you.
Thank you very much. The social behavior change is very important.
Don't forget.
Hey, gote Devashish. ଆମର ଡକ୍ଟର ସିତିକଣ୍ଡ ଦାସ ଜର୍ସି ପଳେଇ ଗଲେ।